خواستم چیز
سلایدا چه کار نمی‌کنم.
منظور سلاید هستش مثلا خودش که ازش میگرفت. آره اشکال نداره.
Okay, so when we're thinking about the nurse as a communicator, we need to shift from the treatment of the illness to the treatment of the person that's experiencing the ill health. And I think from listening to what Ebenezer said, this is the thing that he noticed was the biggest difference when he moved to look after people in England, in Britain. That there was very much where he came from, there was very much this person has got this illness, so this is appendicitis, we're treating appendicitis, or we're treating cancer. Whereas over here, we tend to treat the whole person, or try to, rather than just the illness. So you've got your nurse and you've got your patient, so that's two people who bring humanity to the relationship. So it's not just a clinical relationship. I used to describe myself to my clients as your professional friend. So I want you to be able to treat me as though you would treat a friend in some ways. So be comfortable around me, be able to tell me what you think you need to speak about, but remind them that we have a professional distance. So although there are some aspects of friendship between what we have, the majority of time it is a professional relationship. So I'm not going to invite you to my wedding or my night out, but I may share, if I'm feeling, particularly happy one day, I might share a little bit of detail. Be careful about what you share, a little bit, not massive amounts. So we have lots of different perspectives going on. Some people are very, very private and they wouldn't share anything with their patients, and that's fine. It's about whatever you're comfortable with doing. I do tend to share a little bit of myself, but in mental health it's slightly different because there are lots of things that you wouldn't share, because people don't, sometimes they don't react the same way if they're ill as they would when they're well. Okay, so you do need the two people to be an effective communicator. There are different models of communication, but one thing they have in common is you always have a sender and a receiver. So at the minute I'm the sender, and hopefully you're the receivers, so you're listening. Yeah, you've got two of these and one of these. But when it goes from these into this, it's which bit of the memory it goes. Goes in your short-term memory. When you go out of here at 12:30, it's gone. So let's hope some of it sticks in. Okay, so we have three fundamental concepts that we use. First one is speech, obviously. So, but the problem is if you've just got a sender and a receiver, so if you were just sitting in a big lecture theatre and I was standing here at the front and just teaching you, and I said, I don't want you to speak, I don't want any conversation, I don't want any questions, that wouldn't be very satisfactory, would it? Because you might have questions. I'm very pleased that you ask me questions, you stick your hand up or you shout or whatever. That's nice. So if you've just got a sender and receiver, there's no opportunity for feedback. So as long as you're all awake and looking in this direction, I think you're listening. But I don't really know. I presume you're listening, yeah. I have done lectures where people have fallen asleep. Not very often, but I have done a few. So when you have that sender-receiver, you need a third person or a third thing, which is the feedback, in order for it to be valuable. But then what happens is, don't worry too much about the names of these models. You don't really need to know that. But what you have is lots of these barriers. So I'm sending you a message, you're receiving the message. There's a man outside with a drill, maybe, doing a building, so the noise is stopping you from hearing. Okay? Or you might have just had a phone call from your nanny to say your children are crying and you're worried about that. So that'll stop you, Or I might just be totally bored because I've delivered this lecture 146,000 times and I might just be talking through it. So that would be a barrier because you sensed that I was bored. However, I don't ever get bored of doing this lecture. I like doing this lecture. So there's lots of barriers, lots of things. It's almost like you're walking along, but you've got a rucksack on your back that's full of barriers. So you might not have slept very well because you've got an issue with your accommodation. You might have a problem back at home. When I say home, I mean your country of origin that's worrying you. There's lots of things that are going on that I'm not aware of that might be stopping you from being able to take in and retain what I'm telling you.
Your empty bucket.
My empty bucket, yeah. Yeah. Who knows about a bucket? Leave the empty bucket for next week. Someone's been reading before they should. Okay, so if you've got problems in both your intimate relationships or your home relationships and your work relationships, they often centre around poor communication. This drives my husband mad because he knows I teach this, and I think I'm quite a good communicator. He's a man, and he's a man's man, and he doesn't do feelings, and he doesn't do touchy-feely, and he doesn't do any of this talking about stuff. So when I say to him, how are you feeling? He goes, stop talking rubbish.
They don't know how they're feeling.
Yeah.
There's a big problem.
And that's why there's more men
on
commit suicide because of that. We'll talk about that next week. So, you know, he listens, but I think he listens. I'm not sure, actually. Depends on what football's on the telly. There's football, there's no reason, you know. Just don't talk to him when there's football on. Okay, so if you're not listened to, how do you feel? Ignored. You said before, didn't you? You're not listened to, you're ignored. Feel devalued? Yeah. Frustrated? Neglected. So you're sitting in a hospital bed and you feeling all this, and someone's going to come along and take your appendix out, or your tonsils, or treat you for an aggressive cancer. So that's bad enough, and then you've got all this poor communication that's making you feel bad anyway. You know, so you know how much easier it is to treat someone if they've not got all that stuff going on around the outside. You know, if you're communicating with them properly, if they feel valued, if they feel like you care about them, it's so much easier to tell them difficult things, you know, to give them bad news, to give them bad results, if you've got that relationship going on. Okay, so all these things, so not knowing what's going on, not being taken into account, all these things will lead to that sort of feelings, you know. And all this shows is that ending a message isn't the communication. So just giving somebody a message isn't interpersonal communication. You've got to get the feedback off them to see did they hear the message, did they understand the message, did they retain it, did they know what you're talking about, did they understand what that means for them. Okay, so we have massive webs of relationships, and we treat all these people, or we communicate, with all these people differently. So I would say things in my family that I would never say to a student or a patient, but I say things to students and patients that I wouldn't say to my family. So you communicate differently. Those levels of communication change. You know, sometimes my language isn't as good as it should be, and I mean bad language, naughty swear words, that's what I mean. Sometimes swear words slip out, but there are some people that I would never swear with, you know, like my nan. If I'd have said any words that were bad, she would have gone. She used to say, Deborah, and I never get called that. Deborah, I don't want to hear that word again. You know, so I wouldn't swear at work. However, watching Liverpool at the minute, football, I don't know if anybody watches football, that makes me swear. I'm sorry, it does. You know, so we are different. We're different people. We change our communication so it's appropriate for all those different people that we're with. Well, I don't need that one. Different ways of communicating. We know all about those. Emails, a lot easier in some way. But you can get different messages from emails. Sometimes students send me emails and it's like text speak, and it drives me mad. So I got one the other day from a student, because I'm doing some marking at the minute, so students are contacting me and saying, do you want this in the essay, do you want that? And I got one and it said, yo, Deb. Yo, Deb. And I was like, I've never met this person. I've never met this person. I don't know who she is. I don't know where she's from. I just know that she's in this group that I'm marking her essay. And she sends me a message, yo, Deb. Yo, Deb, got a question about my essay. I felt like sending one back saying, yo, whatever your name is, I've got a question about your language. So yeah, you have to be careful when you're communicating. So what's this picture saying to you? What's going on there? Is it a nice picture? Is it a nice picture? Yeah.
The guy is talking to a child.
He's talking to a child, so he's down at the same level, yeah. Smiling. Yeah. Eye to eye contact. So there's some teaching going on there, isn't there? Yeah. One of the things I try to do when I'm teaching is I try to look at everybody, which is all right when there's 20 of you, But in a room of 140, you're going like this. Trying to see everybody.
They listen to him carefully.
Yeah, he is. He's listening very carefully. Right. So, how's he feeling?
Sad.
Yeah.
Exhausted.
Sad. Yeah.
It's so exhausting.
This is called kinesics.
What does that mean?
It means looking at people's body language. So without any speech, what's the body language saying? So if I'm like, when I talked about my mother-in-law, and when I went to see her, she was like that. I've not said anything, but you could tell from my body language exactly how she was feeling.
Well, actually, culture is affecting the body language as well.
Absolutely, it does. It does. I'm trying to think of some examples.
I will give you an example.
Give me an example, yeah.
Okay, in our culture,
Yeah,
when I talk to you, when I use my hand,
yeah,
I'll not look to you in your eyes.
yeah.
That is mean I will respect you.
Oh,
But here, you
Yeah.
have to look to have like a full eye contact.
yes,
That is mean you are confident.
yes.
In our culture, it's disrespect.
Yeah, that's a very, very good example. Yeah, and in mental health, eye contact is very important.
I know.
A lot of people with mental health problems don't look at you in the eye, or if they're angry with you, they're like that. They look at you like this all the time. Now that's uncomfortable, isn't it? Very uncomfortable. So kinesics is about things like eye contact. Oops, I'm back. There he is.
Excuse me, we're just discussing that because we are so used to respecting and not looking at people when we're talking to them. And in this country, things are different. So if you don't look at them, they'll think you're mentally
Essentially, if I was sitting talking to you and you didn't look at me at all, I'd be thinking you were depressed. I may think you're depressed. It would cross my mind that you were depressed. So body language. Okay. What's she angry?
What's she angry?
She's angry. Yeah, she's got a red face. She's
Aggressive.
frustrated, isn't she? Very angry. She's got very nice green shoes on though. What about him?
She's ordering.
Yeah, very bossy, ordering something. Bit scary as well, his eyes. He's very focused with his eyes. What about this?
People scared.
Yeah, she's like
Scared.
very scared. So the eyes are wide, white. You see the whites of their eyes. Say, that's it, yeah.
Her eyes is popping up.
Yeah, her eyes are popping out. Yeah. See, this is universal, isn't it?
Oh, he's laughing.
He's laughing at her because she's scared, right? He's shouting at him because she's frustrated and he don't care in the middle. So can I ask you to do a little experiment? Could you stand up for me? Yeah. Just stand there, put your mask on. Let me see. Could you pass that video and then can you stand up for me? If you want to carry on. Just stand looking at me there. Then back up there. Back up, the other way around, but back up. Yeah, no. Turn round. Sorry, so you'll face me. Oh, walk further back. That's it. Stand, not down. What is it? Chateau, can you come and stand here? Nossie, could you come and stand there, please? Are you okay? We're just doing a little experiment. Just stand there, yeah? Right, what I'm going to do now is I'm going to illustrate proximity, because this is a cultural thing very much. So I'm going to speak to you and I want you to tell me to stop when you're not comfortable. Okay? Bear in mind we've got COVID, so this has made things a little different, but we've got masks on. I've had 2 tests and I'm negative, so I'm a negative test. I've had 2 injections and a negative test, so I'm fine. Okay, so I'm going to speak to you now. Just stop me when you're not comfortable. Okay, so I'm still speaking to you. Are you okay? Are you okay? This close? Oh my goodness, that's very close.
Oh, that's very close.
Right, okay. Are you all right? Was that too close? Right, try again. So just go stop when you would normally like me to be comfortable distance. Okay, so that's a yard. Okay, Jetto, that's the same to you. So can you tell me to stop when you're not comfortable? There. So it's a little bit further. Okay, I'm going to do the same with you. Can you tell me to stop when you're not comfortable? I'll keep walking towards you. You tell me to stop. That's even closer. Okay, thank you. You can sit down. Sit down now. So what that's shown me maybe is that Chatto's a bit less comfortable. Maybe because I'm a female. So in your culture, would you stand further distance from a female? Yeah. You were not very comfortable when I got fairly close. Were you? Yeah, when I got really close, that was really uncomfortable. So, is that where you would normally want someone to stand? Yeah? But Nossi, you were comfortable when I got quite a lot closer than the other two. So that's illustrating how people's values are different. And when I do this, it's off now. Thank you for that. When I do this with pre-registration students, I usually choose someone who looks a bit wacky, so they might have purple hair or piercings. I usually choose an older lady and a gentleman. And if I know where they're from, I tend to choose someone from a different ethnic background as well. And everybody's different with something very simple like how close you stand to someone. So you have to bear that in mind. So the first time you meet someone, stay back a little bit and then you'll get to know them a bit better. Right? Very easy experiment to do. Right, facial expressions. You've all got quite interested facial expressions at the minute, which is great. I like that. So they can hide your feelings or they can show your feelings. We've already spoke about eye contact. You know, we look more at people that we look like. Right, so this is from a British cultural point of view. So within the NHS, we tend to look more at people that we like. Okay? Have you ever been in that situation where you're out maybe as a single person and you're maybe having a drink or you're in a restaurant and you catch someone's eye and then you go,
Another, yeah.
Another
I saw him somewhere. Yeah.
and you look more often, don't you, at that person? Okay, next time you go out, and I know this might be a while because of the whole COVID thing, but next time you're in a social situation, just observe people's body language. Observe how often they look at other people. You can easily tell when someone's bored. You can tell when someone likes somebody else. And something that you will notice is when there's a couple or two people that are chatting together, they'll do this quite a lot.
Yes.
Or they might go, how you doing? Right? The reason they do that is because years and years ago, we were attracted to each other because of our smell, our pheromones. Okay? And where do we smell most? Armpits. So if you go like that, right, then your pheromones from your armpits. Yeah. There are some people I wouldn't want to get anywhere near their armpits. But it's that much ingrained in our what's the word? Our habits. Yeah, it's amazing how often you see it. I sometimes have a little giggle to myself if I'm out having a drink with my friends and I see some fella come up and go, "Oh, what are you doing here?" His armpit smells wafting everywhere. So we do things unconsciously. We don't know about that. We don't know we're doing that. It's an ancient thing that chimps do it, and you know, dolphins communicate in different ways. But a lot of what they do, it's come from us developing and how much we've developed. Gestures, again, these are very cultural. You know, some gestures mean something very, very different in this country than other countries. You have to be very careful when you're hitching a lift in Greece, because in this country, if you're getting a hitchhiking lift from somebody, which I would never recommend, please don't do it, it's very dangerous. But you stand at the side of the road and you go like this, with your thumb. Right, and what that means in this country is you would like someone to pick you up and give you a lift somewhere. Again, don't do it, because it's strangers and it's not safe. But in Greece, apparently this means something completely different. It's a swear word. So don't be doing it in Greece, otherwise you might get arrested.
I have an example of this. My friend, she was me, we ordered taxi, and she said, 2 minutes.
Oh dear.
The taxi man started swearing on me. I said, what? And when I looked to my friend, she was saying, 2 minutes. I said, no, she's mean this.
2 minutes, yeah. There's a very different gesture. Yeah. Okay, gestures are very, very important in nursing. Very important. You know, the little gesture. What about touching patients? So if you've got a patient, but you can't touch the patient.
We can touch
You
the
can't
patient
touch them.
appropriately.
Yeah. So if you've got a patient that's crying, would you go and put your arm around them?
No. If we don't know the patient, we can do that.
Right. So you just give them a little tap. Yeah. Okay. In mental health,
No.
don't do that. Don't do that. What about across the sexes? So if you're a male nurse, again, there's only you here today, so right. So Chato, if you're a male nurse and you're working on a mixed ward, and you have and there's a lady that comes who's confused, and she comes out of the ward and she takes the top off. Okay. How would you deal with that?
Try to put his headphones.
What would you do?
Well, I'd like to. I would do to relax here and maybe I will try to calm down here and explain the situation, what makes angry or
So you
what
would
makes-
deal with it?
yeah.
Now some men would run off or would shout for a woman straight away.
Oh no.
Yeah. Now in this country, male nurses and female nurses are interchangeable in a lot of situations. In some, you should always ask if you are a male nurse or if you're working with a male nurse with a female patient, you should always ask the question, is it okay, if I deal with you, or would you prefer a lady? The same is true if you're working with male nurses, male patients. I suppose you should always ask, would you prefer a male nurse? However, we've hardly got any. Not many male nurses, so it seems more acceptable in this country for a female nurse to do intimate care on a male patient than the opposite. And then I would say to you again, as a male nurse, I wouldn't be doing intimate procedures on a female unless there's another female there. But you should always ask the question. Okay. Yeah, talked about posture already, so you can tell. You make decisions about people from the minute you see them. So when I first walked in on Monday morning, I'm sure you all looked at me and thought different things about me before I opened my mouth. I hope whatever you thought about me then, hopefully, has changed now that I've spoke and you've got to know me. But like the way I dress, I think about the way I dress, being I come teaching students. I don't dress like this during the day at all. I don't wear jeans. These are quite close to jeans, actually. Yeah, they're comfy, yeah. But I've got to think about what to put on my feet because I don't sit down really. But also the way I present myself to students is very different from the way I present myself to my friends. I don't wear dangly earrings with students, but I have a thing about earrings, I like big earrings. But I don't wear that. I have a different dress because I think when I walk into a new class, they need to think things about me. So you need to think that I'm professional, but I'm friendly. You need to think that I'm knowledgeable, but I'm open to go, I don't know, but I know a man who does. So you think about the way you dress, every time you go into a different situation. When you get your interviews at the end of this 4 weeks, I don't know whether you will, but you may wear something that's slightly more smart than you would when you're coming into class. So think about everything. Communication is everything that we do. Right, I've just whizzed through these. The angle you are, which I've just the proximity I've just demonstrated, is different for different people. Okay? The touch should be used with caution, and some people's boundaries are much further than others. Sometimes people just need a hug, like you said this morning. You just need a hug. But you get to know your patient. If you're therapeutically communicating with your patient properly, you will get to know, whether they like that or not. And your appearance, I've talked about that already. Right. So you've got to be aware of your own and others' verbal communication. So be aware of what you're saying and how you're saying it. Right. So if I say to you, "How are you doing?" I'm fine. But if I come to you like this and I go, "How are you doing?" I've scared you now, haven't I? So that's very different, isn't it? So I've said exactly the same words in a different way. Okay, and I think you're traumatised for the whole day now. So. But if I did it to Chateau, it'd run a mile. So. Okay, so think about not only what you say, but how you say it. So if you're a nurse and you've got work to do, but you're going to give someone the blood results, if you go in and go, "Oh, I've got your blood results," so you've got a piece of paper and so you go in and you go, "Oh, I've got your blood results. Yeah, you need to stay a bit longer. Something's not right." You've given the message, so you've told them they've got blood results, but you've told them something's not right. Well, that's not suitable, is it? That's not so what you would want is just someone to come in, to sit down. Right, we've got your blood results today. There's a couple of things not right, so how do you feel about staying in another night? Do you think you can manage that? Is there anything we could do to help you with that? Do you need anything looking after at home? I'm going to get the doctor to come and talk these blood results through. Don't worry, we can sort it out, but it's just not what we expected. It's not. Yeah. Okay, so it's a lot better, a lot easier You still give the same message, exactly the same message, but the way you presented it is totally different. So remember, everything we say and do will be observed by somebody. So it's always being observed by somebody. Okay. Even if it's just the patient, it's just, and you know, then it's if that patient says to you, I felt undervalued or I felt ignored, even if you don't believe you did that, the most valuable thing is the way they felt. So you need to learn from that. Okay. So that's the nurse and communicator. As I say, it's a bit basic, and a lot of it you know, but it's good because you get to learn the words that we use, like therapeutic and that sort of thing. You get to learn the words that we use. So my next thing is about reflection. So not only are we teaching you to communicate properly,